Hello everyone, we are from group 2. Today we are going to talk about wrinkle, dry and broken skin. The skin, along with its accessory structures like oil and sweat glands, makes up the integumentary system. The skin protects the body from infection, helps regulate body temperature, and contains nerve receptors that detect pain, sensation, and pressure. However, skin can be damaged due to several conditions. In this paper, we will talk about the changes occurring that make our skin wrinkle, dry, and broken. Most of the age-related changes begin at about age 40 and occur in the proteins in the dermis. Collagen fibers in the dermis begin to decrease in number, stiffen, break apart, and disorganize into a shapeless, matted tangle. Elastic fibers lose some of their elasticity, taken into clumps, and fade. Fibroblasts, which produce both collagen and elastic fibers, decrease in number. As a result, the skin forms the characteristic crevices and furrows known as wrinkles. The pronounced effects of skin aging don't become noticeable until people reach their late 40s. Intraepidermal macrophages dwindle in number and become less efficient phagocytes, thus decreasing the skin's immune responsiveness. Moreover, decreased size of sebaceous glands leads to dry and broken skin that is more susceptible to infection.
Dry skin is often temporary or seasonal, and maybe you might need to treat it for the long term. For signs and symptoms of dry skin might vary based on your age, health status, skin tone, living environment, and sun exposure. So for the symptoms, they include a feeling of skin tightness, skin that feels and looks rough, itchiness, then slight to severe flaking skin, which causes the itchy look that can affect dry brown and black skin, slight to severe scaling or peeling, then cracked look to leg, then fine lines or cracks, then skin that ranges from reddish on white skin to grayish on brown and black skin, then finally deep cracks that may bleed.
Dry skin is to do a water loss from the outer layer of the skins is to might be caused by the heat, the central heating, the wood burning stove, the space, the heaters, and the fireplace all reduce the humidity. The second reason, the environment. Living in cold or windy condition will allow humidity. As one of the reasons is too much bathing. Taking long hot showers or bath can skin too much can dry your skin. Bathing, as one of the researchers said, that bathing more than once a day can remove the natural oils from your skin too. One of the reasons as well, harsh soaps, many popular soaps are actually our shampoo are strips the moistures from your skins because they are formulated to remove the oil. One of the cases we have the other skin condition. People with the skin conditions such as the atopic dermatitis like eczema are more likely to have a dry skin. As well, one of the reasons, the medical treatment. Some people develop dry, thicker skin after undergoing treatment for cancer or maybe taking a certain medication. Last one we have is the aging. As people age, the skin thins and produces less of the oils needed for the skin to retain to the water.
For the complications, dry skin is usually harmless, but when it's not cared for, dry skin may lead to the first one, atopic dermatitis, or as it's known as eczema. If you are prone to develop this condition, excessive dryness can lead to activation of the disease, causing rash and cracking skin. Then infections. Dry skin may crack, allowing bacteria to enter, causing infections.
Now we go to the prevention. Try these tips to help your skin retain moisture. First, moisturize. Moisturizer sells in water to help keep your skin's protective barrier healthy. Use moisturizer throughout the day, especially on the hands. And before going outdoors, use a moisturizer that contains sunblock or broad-spectrum sunscreen with an SPF of at least 30. Even on cloudy days, apply sunscreen generously and reapply every 2 hours or more often if you are swimming or sweating. The next one is limit water exposure. Keep bath and shower time to 10 minutes or less. Use warm, not hot water. Rinse and pat dry. Try to bathe no more than once a day. Use a gentle cleanser or allergen-free soap. Try a non-soap cleansing cream or shower gel, or use fragrance-free moisturizing soap with no alcohol or allergy-causing substance, or hypoallergenic soap, especially if your hand wash often. Rinse thoroughly and pat dry. Apply a moisturizing cream while your skin is still damp. Shave with care. Shaving can be drying. If you shave, use a lubricating agent before you start. Shave in the direction of hair growth, unless that irritates your skin. Use a sharp blade and rinse it with warm water after each stroke. When done, apply a moisturizer. Cover as much skin as possible in cold or windy weather. Harsh weather can be especially drying to the skin. Scarves, hats, and gloves or mittens help protect your skin when you are outdoors. Wear gloves. Protect your hands with suitable gloves when gardening, using harsh cleansers, and doing other skin drying activities. Drink when you are thirsty. Drink non-caffeinated beverage each day to help keep all your body's tissues, including your skin, well hydrated. Bathe babies with care. For babies, using a cleanser every 1 until 2 weeks for bathing usually is enough. Otherwise, bathe them in just water. However, clean their diaper area with each diaper change. Apply a thin layer of petroleum jelly or Vaseline, Aquaphor, and others while the skin is still damp. So, that's for our material presentation. Thanks for watching. Wassalamualaikum warahmatullahi wabarakatuh.